whenever there's a negotiation like this, yeah, if you get to a compromise, that usually means that everybody's given a little bit, right? So I was had some concerns about the length of the contract, but the reason I thought it made sense to move ahead was I believe that we were hearing the county employees and the public, and doing what they asked us to, and acknowledging that right now is not a really good time, for example, to give the highest paid county employee a raise. And so we made sure that we did not do that, and I felt very good about that part of the contract.
Have you at all heard from any constituents who are disappointed with your recent vote?
I've heard some that are not pleased with the length of that term, as I mentioned, but the several emails I've seen specifically pointed out that decreasing some of those contract benefits, the severance period, as I mentioned, and also decreasing his pay by $10,000 instead of increasing it by $14,000, really was that acknowledgement that I think members of the community and especially county employees were looking for from the board.
Your experience is unique because you are a physician and because you are a supervisor. This week, a judge ruled that Pima County's curfew with regard to COVID-19 should be on hold temporarily. As we know, the vaccine is rolling out this week. What insight are you offering the board as this moves forward?
That is actually one of the main reasons that I ran for this position. I was looking forward to bring my healthcare expertise, that medical background that I have, and to share that with the other board members, especially regarding pandemic response. I'm very proud of actually how the county has set up infrastructure for vaccine administration. Frustrating is, of course, the speed of the rollout due to the lack of adequate supply, and that's something that we don't have direct control over, but still is frustrating. With regard to the court's ruling, I'm very concerned because I am on the front line admitting patients with COVID, and we, as the county, have the responsibility of implementing whatever public health measures we can to help mitigate the spread of this virus until that vaccine is adequately distributed, and also until we can hopefully get better and more curative therapies. So that is, to me, very disturbing.
There is some concern amongst people in Pima County that the county has pushed a little too far with shutting things down, like the curfew, for example. What do you say to them?
If you would like to join me in the hospital and watch people suffocate, and when there's nothing, unfortunately, ultimately, that we can do to help these folks, watching people die alone or with strangers, or talking to their clergy on FaceTime again and again and again, to the point that nurses are quitting, that healthcare providers are leaving healthcare forever because of the amount of emotional stress, and seeing these patients go through what they go through every day. It's I would invite anybody who wants to come with me, if I can get the permission actually from my hospital, to come and see this firsthand, especially other elected officials, because it's not a hoax. It's happening every day and every night. And if everyone saw what this disease does to sometimes 20-year-olds. I've had several pregnant women who did, luckily they survived, but it was very much touch and go for a while. What this does to the body that we really can't stop, I don't think anybody would argue with even a stay-at-home order, much less a curfew.
Okay. Matt Heinz, Pima County Supervisor, thank you.
Thank you very much.